The medication that I'll be administering today is dimenhydrinate. The class is an antiemetic and it is used for treating nausea, vomiting, and vertigo. It's contraindicated in any hypersensitivity. The adverse reactions and side effects include drowsiness, dizziness, headache, palpitations, dry mouth, diarrhea, or constipation. The onset for this medication is 20 to 30 minutes. The peak is unknown. The duration is 3 to 6 hours. The dosage range for adults intramuscularly is 50 milligrams every 4 hours as needed. And some nursing implications include to assess for nausea, vomiting, and bowel sounds, and to assess for signs of dehydration. So 2 relevant policies include to administer medications ordered between 2 and 6 times a day within 1 hour of the standard administration time. And medication orders must be prescribed in a clear, legible, and complete manner by authorized prescribers according to the standards and guidelines of their respective college. So now I am going to open the chart and I am going to review the information about my client today. So the patient is Sid Garland. He is a 54-year-old male that has been admitted to the hospital for a below-the-knee amputation of his left leg. The patient has suffered from a gangrenous foot ulcer for the past year prior to amputation. The patient is 3 days post-op. He reports pain as a 5 out of 10 to the right calf. As needed, subcutaneous morphine for pain started yesterday. The patient may have oral analgesics for breakthrough pain, and the patient continues on anticoagulant therapy for DVT. The patient has been complaining of nausea with 3 episodes of vomiting since starting cefazolin. The patient has been started on an antiemetic. So now I'm just reviewing any lab values. And I'm going to sign the patient's chart. And now I'm going to compare the doctor's orders to the MAR. So the patient's name is Sid Garland. The medical record number is 344316, 344316. His date of birth is 11/08/1965, 11/08/1965. His allergies include penicillin and codeine. The medication I'll be administering is dimenhydrinate. The medication ordered is dimenhydrinate. The dose is 75 milligrams. The route is intramuscular. The frequency is every 6 hours. There's no special instructions for this medication. The time I'll be administering this medication is the 6 o'clock dose. And the reason for this medication is to treat the patient's nausea that he is experiencing. Before administering this medication, it would be important to pre-assess for bowel sounds on this patient, and it would also be important to ask the patient if he's experiencing any current nausea or any vomiting at the time. And it's then important to be aware of where the patient last received the last dose of this medication. So the patient received the last dose of this medication in the right ventrogluteal site. So this time I will be administering it in the right vastus lateralis site to rotate the sites. And now I am going to perform hand hygiene. I'm going to grab the correct medication and I'm going to read the expiry date. The expiry date is December 2028. And now I'm going to perform my first check with the medication to the MAR. So the client's name is Sid Garland. The medical record number is 344316, 344316. His date of birth is 11/08/1965, 11/08/1965, and his allergies are penicillin and codeine. The medication is dimenhydrinate. The medication is dimenhydrinate. The dose, the medication comes as 50 milligrams for 1 milliliter, and the dose ordered is 75 milligrams. The route is intramuscular injection. The route is intramuscular injection. The frequency is every 6 hours. There's no special directions for this medication, and I will be administering the 6 o'clock dose. The site will be the right vastus lateralis, and the reason for this medication is to treat the patient's nausea. Now I'm immediately going to perform my second check with medication to the MAR. So the client's name is Sid Garland. The medical record number is 344316, 344316. The date of birth is 11/08/1965, 11/08/1965. The patient's allergies are penicillin and codeine. The medication is dimenhydrinate. The dose, the medication comes as 50 milligrams for 1 milliliter. The dose ordered is 75 milligrams. The route is an intramuscular injection. The site will be the right vastus lateralis. The frequency is every 6 hours. There's no special directions for this medication, and I will be administering the 6 o'clock dose. And the reason for this medication is to treat the patient's nausea. So now I am going to perform a calculation to calculate what dose is needed. So I will, after doing my calculation, I am aware that I need 1.5 milliliters of this medication. So now I am going to open my blunt-filled needle. My syringe. I am going to attach my blunt-filled needle. I'm going to draw up .5 milliliters of air. And I'm going to inject it into my medication. And then I'm going to draw 1.5 milliliters of my medication. Actually just over that, so I can have extra to prime the needle. I'm just going to get rid of any air bubbles. going to recap. And I'm going to maintain asepsis. To put on the injection needle. And then I'm going to prime the injection needle up until 1.5 milliliter. Just going to hold it close up. Okay. And now I'm going to perform my third check against the medication to the MAR. So the client's name is Sid Garland. The client's name is Sid Garland. The medical record number is 344316, 344316. His date of birth is 11/08/1965, 11/08/1965. His allergies are penicillin and codeine. The medication I'll be administering is dimenhydrinate. The medication is dimenhydrinate. The dose I'll be administering is 75 milligrams. The dose that the medication comes as is 50 milligrams per milliliter. After performing my calculation, I know I need to give the dose of 75 milligrams, which is equal to 1.5 milliliters of the medication, which I have in my syringe. The route will be intramuscular injection. The site will be the right vastus lateralis. The frequency is every 6 hours. There's no special directions for this medication, and the time I'll be administering is the 6 o'clock dose. And the reason for this medication is to treat the patient's nausea. So now I'm going to just double check my calculation by turning my sheet over and performing it again. So now that I've performed my calculation again, I've got the same answer, which is 1.5 milliliters. That's the first time, 1.5 milliliters. I would call over my co-assigned nurse to double check my calculations and my syringe before heading into the patient's room.